Welcome everyone that is here so far. It is 5 o'clock here in LA. I am Cody Elaine Oliver, the co-creator of Black Love and director of the series. I will probably say that a few more times as we allow people to log on to this town hall. My husband and I created Black Love, the docu-series, to talk about what it takes to make a marriage work. And then we launched blacklove.com and our social platforms to talk about 360 degrees of Black love. So parenthood, sisterhood, brotherhood, self-love, dating, partnership, and love of community. And so we created these platforms to really extend the conversation and the transparency that you see on the show when we talk about marriage and relationships. And we wanted to extend that into all facets of our lives. And so while something like this town hall may seem abnormal for us, the reality is we're just trying to do our best to help our community, live and be our best selves, right? And this weekend, we aired an episode of Black Love that was called In This Together, about the coronavirus and the fact that, when we did the interviews, it was May. We did them over Zoom, which you probably noticed. And we just want to talk to couples. We wanted to talk to couples who were affected by the virus at the onset and what their experience was. And my experience of doing those interviews was really just seeing an angle that I had not seen before. You can read the articles, you can watch the news, but I felt, somewhat unfairly, because I did not have to experience it, but I felt like I was experiencing it through them. I was left taking little bits of that and frankly internalizing it. It affected how I operated in our household. It affected fights my husband and I had about whether he should protest back in June. That's how much these couples' stories touched me and affected how I was living every day. And when we put the episodes out this weekend, two things were apparent to me, or as we were leading up to that. One is that this was the beginning of it. This was the onset of the virus. There was so much misinformation. So we wanted to properly contextualize it. We wanted to say, all right, we've learned some things since then. How can we apply those things? And what are they? Because there's a lot of stuff that hasn't changed. And also that we wanted to give, viewers an opportunity to ask questions. So I gathered together, we've gathered together some very smart folks to talk about their experience with the virus. We typically don't feature experts on our platform because we never want to seem like we're talking at you, right? But in this case, this is a time where we need to, properly surround ourselves with the right information. That was the problem. That's how this all started. So, it's important for us to spend the next hour talking about the episode, the virus. We want to hear you all's questions. You can send them in, like at the Q&A screen at the bottom. You can put them in at any point, and we will be here to get them answered. So I'm going to start. We will start just with a clip. Let's see. We'll start with a clip from the episode, just really talking about some of the misinformation that we all experienced.
They were saying kids were immune to it. It's not, the kids are going to be okay. It's not a virus that affects the children. So I think even hearing that, it was one of those things like we weren't as worried. But again, we weren't as worried those first couple of weeks anyway, to a degree that we thought it would harm.
The scariest part about all of this is the uncertainty and the lack of information and the inconsistent information that we all seem to be getting. Some of it is not intentional, but some of it is really, nerve-wracking.
So I'm pretty sure that many of us relate to that experience because, we started this out, as several of our couples mentioned, we started this out basically hearing from our government that this virus wasn't going to get to our country. So I want to bring up first RASHAWN Ray. He is a sociologist who I discovered writing for the Brookings Institute, and you have shared so much information about how the virus is affecting our community. And that was important to me. And the reason I wanted you here is because I feel like more often than not, we're told, oh, this happens to Black people. Black people are the most affected. And when you don't hear more information than that, it's like, oh, because we have melanin, we're more likely to get sick. And that's really not what it boils down to. But I wanted to talk a little bit about that lack of information and why you think there was a lack of information surrounding this virus from the beginning.
Yeah, well, thank you for having me on. It's definitely a pleasure. Your show is simply phenomenal and so important in not only our community, but also throughout the country and the world in terms of telling our stories. I mean, when we think about the lack of information, I mean, we can really pinpoint it directly to the White House. And the reason why we can do that is because under President Obama, they had a pandemic response unit. Okay, this pandemic response unit not only aimed to deal with pandemics once they hit American soil, but actually aimed to help other countries deal with pandemics that were happening in their own country. We can think about Ebola as a really good example. Now, H1N1, which is something that people always highlight, it was happening during the Great Recession. A lot of people got H1N1, but it wasn't as deadly as COVID-19, nor was it anywhere near as deadly as Ebola. But when Ebola hit US soil, there were only 2 people that ended up essentially dying from Ebola in the United States. I mean, it was shut down. It was one person who came and another person. And so when we think about that particular part, Trump actually dismantled this pandemic response unit that was in the White House. And that helped to single-handedly further expose people. What we also know is that Trump also stated that he aimed to not alarm people. Therefore, he really wasn't transparent with the American public about what was going on. And of course, that sent people into a frenzy, whether that was, fighting over toilet paper or standing in sitting in long lines for gas and these particular things. But when I think statistically, what I know is that the United States is number 1 when it comes to healthcare finances, number 1 out of a study of 200, but only 175th out of nearly 200 when it comes to healthcare access. That access is one of the things that's really, really important in terms of how we need to think about it. And what it led to initially, I mean, look, there were famous people getting it, right? So people were thinking, okay, look, presidents of universities are getting it. People like Tom Hanks are getting it. Initially, there weren't Black people initially getting it. And people also thought that more wealthy people, higher status people were getting it. So it had a lot to do with travel, which it did, obviously. It travels across space and time. But all of a sudden, when Black people started getting it, and we primarily seen that with the NBA, we started to see a very, very different outcome.
So how do you think that the misinformation led to us getting it more?
So part of what happened was people just went on about life is normal. So people were going to work. People knew that there might have been something going on, but people didn't realize how deadly it was or what was going on, particularly because it presents in some ways as similar to the flu. So people just weren't making sense of it. It had not initially hit Black communities. And once it did hit Black communities, I mean, of course, we know the damage that COVID-19 has done.
So, a couple of things that I've read that you've talked about is some of the factors that are specific to Black people in this country, how we live, where we live, et cetera, that were the contributing factors to us, over indexing on getting the virus and dying from the virus, that have more to do with just the fact that we're brown.
I mean, that's exactly right. One of the things that I've written about is the way that structural conditions manifest in our lives. Structural conditions are things that govern our lives in ways that we don't always notice it, but they do. The neighborhoods we live in, the types of jobs that we work, whether or not we have access to healthcare. And so when people oftentimes try to focus on Black people's behavior or our blood, like supposedly what our Blackness and brownness does, that's not really what research bears out. Instead, research highlights that structural conditions lead to deleterious health outcomes. So we know that we live in neighborhoods that are underserved, that don't have the types of investments that they should. So this leads to a lack of healthy food options, a lack of recreational facilities. I mean, anyone that's been in predominantly Black neighborhoods, whether you're in Oakland, LA, Washington, DC, Philly, or Memphis, or Atlanta, you know the impact that these sort of things have, because funding for what's happening in local communities is oftentimes tied to real estate. So we know that our property is devalued. So we have a lack of healthy food options, a lack of recreational facilities. We also live in densely populated areas. So physical distancing oftentimes becomes a privilege. If you live in New York or you live in DC and you're in Southeast and you're trying to go to work, well, then all of a sudden, how many people do you pass as you are going to these places that you're trying to go to? And then we know that part of going there is that we're more likely to be essential workers. Black people are much more likely to be essential workers, food workers, custodial workers, health aides, people who are serving other people. I heard something recently that was really deep that stated that people haven't really been quarantining. That part of what's been happening is that working class and poor people, their lives have been continuing as normal, while middle class and upper class people are having things brought to them in their home while they work at their house. I thought that was a pretty profound statement about the ways our lives are different. And then we know that even beyond where we work, being exposed to those work conditions, the jobs that we have oftentimes don't have adequate health care. So we don't have paid sick leave. We don't have the types of health insurances that lead to us getting help. And then we know that when we finally go to the doctor, that we are less likely to have healthcare access and receive equitable healthcare. One of the big studies that popped out during COVID is that early on, Black people were 6 times more likely to be turned away from COVID-19 testing and treatment. I tell people, before you start trying to talk about Black people having a get together or a party, which everyone's doing, by the way, before we start talking about that, how about we deal with the structural conditions that lead to governing our lives in ways that expose us to COVID-19?
So, you know, you're absolutely right. And I feel like that's the thing that irritates me about the headlines, because it really just tells us to panic, right? And the reality is understanding all of those conditions allows us to consider our options, allows us to consider what we can do for and with our loved ones. And without that information, we just panic. And we'll get to mental health a little bit later. And we'll also talk somewhat about the, you know, what you described as a racial empathy gap in healthcare.
Yep.
We're less likely to be cared for respectfully by non-Black doctors.
I mean, that's exactly right. I mean, when we go to the doctor, not only do we have to deal with getting there, which poses a problem during the pandemic, but we are treated less equitably. I think one of the biggest outcomes that highlight racial inequality and racism in America is the maternal mortality rate. We know that when Black women go to do something what should be the most glorious day of their lives, oftentimes they end up dead. And I know that there are actual physicians who I know well, whose wives have almost died after delivering their children. We also know that we cannot outclass racism, that it doesn't matter how much money you make or how high your status is. And all we have to do is look at Beyonce or Serena Williams and listen to their stories. And the bottom line when it comes to COVID-19 is that when Black people go to the doctor, when we go to the hospital, when things are busy, we are less likely to be treated as human beings, more likely to be treated as objects and animals. And when it comes to these disparities, I mean, they are striking in ways that I don't think people really realize. When people say that Black people are about 2.5 times more likely than whites to die from COVID-19, what does that really mean? Well, what it means is that 1 out of every 920 Black people, 1 out of 920 have died from COVID. And 108 out of every 100,000 Black people have died from COVID, compared to only 54 out of every 100,000 white people. So what that means is if Black people had the same rate as white people, if that 108 out of 100,000 was 54, there would be over 21,000 Black people still living right now, walking around in the United States of America.
So there's the disparity in terms of our living conditions, which greatly leads to us being infected and contracting the virus. Then there's the disparity in our healthcare, which greatly leads to us being more likely to die from the virus. And those two things, you know, play into each other, but they're also different. I appreciate you, you know, spelling that out for us. So I want to bring in Dr. Jennifer, because you mentioned quite a few things that can speak to, you know, her background. Now, Dr. Lincoln, I call you Dr. Jennifer because I'm like a fan on TikTok. But I I first discovered you when you shared a video about Black maternal health specifically, and how Black women are receiving less than, appropriate health care because there's actual racial bias in hospitals.
Mm-hmm.
And it was the first time I had heard it said from a white doctor. And so I was like, yes, I appreciate you. I appreciate the way you spelled it out for me. And so I want to hear a little bit from you about how, also I want to point out that you are an OBGYN. And so that's your expertise is maternal health. So how did you learn that about racial bias in healthcare, and how has that been received when you talk about that publicly, amongst other colleagues?
Yeah. So first, Cody, thank you for having me. I'm thrilled to be here. And Dr. Ray, if I could just say everything that he said and echo, I mean, he hit the nail on the head, and what a perfect segue, highlighting exactly what you brought up, that there's this racist bias and gap in healthcare. And so in terms of how I heard about it, I mean, you can't ignore the maternal mortality rate, and this is not new information. And how you came to my TikTok and how this TikTok that I put out and went viral, just like you said, you're the first white person you heard, but this is not new information either, right? And so when it went viral, I was very uncomfortable because I thought, why is everybody paying attention to me saying it? Oh, that's right, because I'm a white lady saying it. And so people are listening because of that, which just highlights the racism that's out there, because this is not new information. I felt the need to speak out on it just because I feel like I hadn't done enough to this point, and with everything bubbling up. And I would say that the majority of people have received this information and accept it, and because it's true. There's no secret that there's disparities when it comes to healthcare access and how people are treated based on the color of their skin, and their birth outcomes, like Dr. Ray said, should be a glorious moment, and it's not. I guess what kind of surprised me is that it wasn't 100% acceptance, but that's my own little bubble, right? People who say, well, white privilege isn't real, and white fragility isn't real, and this isn't real, and why don't you care about white kids the same way you care about Black babies? And I'm thinking, and this is why we're in the mess we're in.
Right.
So, yeah.
Yeah, so that part I was very curious about, really, because, I mean, or rather, I would expect it, because that's what we've been faced with all this time, is the notion that the racial bias that typically Black people are speaking up about, especially in healthcare,
Mm-hmm.
where, white medical professionals are going, no way. So I am curious. So you're saying that within the circles that you're in, or at least work, it's not well received? Are they telling you, stop talking about it? Or is there any progress that you're seeing?
Yeah, no, specifically in my hospital system and where I'm at, keep in mind, I'm in the whitest city in the country, right? I'm in Portland, Oregon, and I'm in a super liberal city where we think we do everything right. And even we realize that we have work to be done and we have improvements. So in terms of my colleagues, my coworkers, I feel like almost everybody was like, yes, this is where we're at and we need to do better. It's really people outside of medicine, and maybe again, not in such liberal places or progressive places, I should say, that accept it as much. So I know specifically in my hospital, the nurses started a birth equity and equality collaborative, and we are reviewing policies, looking at policies that are frankly racist. Look at the urine drug screen rates, right? When it comes to patients who get screened for urine drug screens in pregnancy, the majority are people of color, yet when it comes to who in this country are the majority users of opioids illicitly, it's white people. So what's up with that? That's a racist policy when you look into how our policy is structured. So we're reworking that. We're doing some education. It's uncomfortable. It's uncomfortable to admit that you at your core have racist beliefs. But I think something that I've learned throughout all of this is that when we talk about racist people, we're not talking necessarily about the KKK and neo-Nazis. We're talking about racist people being good people. And when I was first kind of coming into this and somebody pointed out white fragility, I was like, I don't need to read that. I'm a good person, And then I read it and I was like, holy, and it's okay to admit that you're wrong. And the COVID-19, like what's going on right now is, how can we not? I mean, this is the disparities that Dr. Ray brought out about the increased rates of death, hospitalization, diagnosis. It has, like you said, it has nothing to do with the melanin in your skin. It has to do with everything that has gone on for hundreds of years that have put people, with Black and brown skin in environments and in these positions where this is not their problem to fix, because they were placed in and they're adversely affected from situations that were, caused by white people. So it's our problem to fix.
So, to be all the way honest, and of course, no one race of anybody is perfect, but is it your opinion that, like, for the best possible outcomes, should Black patients seek Black doctors?
In a perfect world, yeah. I mean, there was a study that came out just in the past couple of months that people, I think it was specifically kids, cared for by Black, physicians do better. And wouldn't that be nice? But there's only 5% of the physicians in the United States are Black physicians. Only 2% are female physicians. So when I think about somebody who says, oh yeah, I want a female OBGYN, good luck, because depending where you live, you might not even have one in your city. So in a perfect world, yes. And what does that have to do with? It has to do with the fact that you see somebody who looks like you, who understands what you've gone through. It doesn't mean that you can't get good care from a white physician, but it's all that extra stuff that you've got to bring to the table that you might have to worry that you have to cross that gap and make that relationship. And again, I'm not saying that we cannot provide good care to everybody, but in a perfect world. And so we need to change how we are, accepting kids into med school and college, and it's all downstream effects. And when I said that on TikTok once, I got somebody who was like, oh, so you just want to let anybody into medical school? And I said, well, wow, a lot was that you just insinuated a lot there. But I mean, we know that it's not representative of the people who can be physicians at all.
So also, what would you suggest that Black people, patients, can do to ensure the best possible healthcare for ourselves? How can we do that?
Yeah, so I made a follow-up TikTok and an Instagram post after that one that went viral, because like you said with your episode, you don't want to just put this stuff out there and you feel helpless and panicky and you're like, well, now what do I do? And I hated having to write that because, again, the fact that you have to do anything is indicative of the problems of this country. But for me, a lot of it is about, if you can seek out a physician who is Black, who you trust, yes. And if you can't, it's about having somebody with you who's a support person. So specifically in labor, think about a doula. If you don't have access to a doula, maybe it's your friend or a family member who can just be that advocate, that voice for you, writing things down, complaining when things are not handled appropriately, calling it out. And if you don't get that gut feeling that somebody's not understanding you or you don't feel heard, it's okay to get a second, third opinion. But I also have had feedback that people have said to me, well, I don't want to be labeled as the angry Black patient. And so there's another problem. So I think there are things that you can do, and it's about being informed, but acknowledging the fact that you have to do even anything extra is already hurting your access to care. And that's why we need to fix this.
Right. But I would argue, and I try with our platform that, you're absolutely right. There's a role to play from the medical field, but I try my best to like empower us, empower the patient in this case. Right. And if I'm boiling it down, it is, don't necessarily be alone, have an advocate, whatever your health issue is. In this case, whether it's childbirth, a doula, whether it's, coronavirus, a friend or family member or someone else who's an ear that you trust and who could probably keep a cool head if needed.
Absolutely.
And ideally seek out doctors that look like you, that can relate to your experience and your background. But if you can't find that, keep in mind all of these other things.
Yeah, definitely, Cody. Yeah.
If I'm boiling it down, that's how I hope that we can empower others.
Yeah, because I think that that's important to realize that you can actively do some things to, to not feel totally at the will of whoever's office you walk into. Yeah.
And frankly, that we don't have a choice. At the end of the day, we can stay home and not be seen for whatever is ailing us, or we can take all of this information and say, how can I apply it to my life and my situation? So that's my hope.
Yeah.
Perfect. Okay, so with that, I'm going to bring in Dr. Arabia. So Dr. Arabia, frontline ER physician in one of the hardest hit areas of our country, in Brooklyn. And you have shared so much with the public about your experience as a doctor, as a New Yorker, and we appreciate that very much. I want to talk a little bit about, let's just start with the episode that we did. We interviewed these couples at the onset of the virus. They were all affected in various ways, but at the onset of the virus, you were in hospitals working and experiencing this, you know, firsthand, day in and day out. So will you talk a little bit about that time, which I know was very painful, and if you feel like if things have changed for the better since March, you know, February, March, April?
So first of all, thank you. I'm honored to be here to discuss this topic that is, you know, it's very popular and everyone can continue to talk about it. But before I answer that question, I just wanted to say, just piggybacking off of RASHAWN, well, the reason why Tom Hanks and Idris Elba, who is a Black man, were able to get tested early on because they were in countries that had the testing capabilities. So in Europe and most other countries around the world, they were utilizing the tests that were given by the World Health Organization. Those were the tests that President Trump refused to allow us to basically utilize as far as testing and identifying those who were positive for COVID-19. And even within the NBA, the reason why those basketball players were able to get tested because of privilege, and they had access to that because of the organization. And so unlike those who were coming from out of East New York and Brownsville, the South Bronx, or Newark, New Jersey, or Newark, New Jersey, my cousin corrected me at one point, those communities we were not able to obtain those testing capabilities. And I could definitely say on the behalf of many doctors that work in the communities, we were screaming out loud and basically protesting through social media to figure out how we're going to get these tests and how we're going to be able to screen. So to go into my story, I am an emergency physician in New York, or in layman's terms, ER doctor in Brooklyn. And it was very painful. We started seeing a high volume in the emergency department, at our emergency department, at the end of February. And we were trying to figure out why so many people were coming in so sick and then suddenly dying a few days later. And we just couldn't understand what was the connection. And then when we started finding out about that, how COVID-19 hit China and Italy, then myself and a number of other ER doctors started ringing the alarm, contacting the Department of Health here in New York, contacting the White House, getting on social media, trying to figure out how we're going to screen people for COVID-19, because we weren't too sure what exactly this disease was. And there was basically quiet from the White House regarding this disease. But then when March 8th hit, I'm sorry.
No, I understand.
I don't think people understand that what it was like for us in New York. I still cry about it because so many people had died. Mm-hmm. Many of my coworkers had died. I had a family member that died. I was resuscitating my coworkers and had to call their families to tell them that their loved one had passed. And these are doctors that died in front of me. These are nurses. These are other people who are just working in a hospital had died in front of us. The amount of people that came into that emergency room from March 8th all the way to, I want to say, May, was absolutely devastating. It hit us really hard. We barely had any information, not only just information, but we barely had the resources to take care of so many people in such a short period of time. We were begging for resources. We were begging for resources to help us, to help the people. But when you are limited with power, when you are limited with the amount of resources, these kind of things will happen. Listen, I was trained in Cuba. That's why I did my medical training back home in Cuba. This is not the first rodeo with the pandemic that I've had. I've worked the Ebola crisis. I worked the Zika crisis. I worked dengue. I've worked in West Africa, East Africa as well. But never in my life I've seen such an atrocity with the lack of response from the federal government. And it was very painful to see people that walked in was struggling to breathe, and there was nothing much that I can do for that person. And so it was hard because it felt like the country and the government were against doctors, and we were killing ourselves to try to do our best to take care of everyone with the lack of support and love. And eventually it was time to speak out. And I spoke out on CNN and numerous interviews about what was happening in the communities. And what we were doing is that we would go out into the communities, and, you know, people that were popular on the block, we would go up to them and say, listen, because you are popular and everybody know you on this block, we need you as a community leader to let people know what's happening and to tell people to stay home. And so thank God for the community of East New York and Brownsville and Starrett City and Canarsie. People came together, Black people came together, Latino people came together to help us out and to really put forth and put in a plan together. I've asked people if they could donate phones and tablets to our hospital because we didn't have a way to communicate with their families because the lines were so busy and so many people came in, it inundated our telephone system. And so people in the community were donating telephones, tablets, everything that you can name to help us. And then we started asking people, if you're going to send your relative to the hospital, to make sure you write down their contact information of whoever's the next of kin, their doctor's information, pharmacy, because everything happens so quickly. And of course, just like everybody else, us as doctors, we were getting different information. One minute it was this way, next minute it was airborne. And we kind of figured out it was airborne based on the presentation and how many people were coming in. And so it still hurts. I've had to go to counseling. And I'm still struggling with COVID-related PTSD, that's post-traumatic stress disorder from this crisis. And I'm just very disappointed. And I work at a poorly underfunded hospital. And when you work at poorly underfunded hospitals, it produces poor outcomes. And that's called institutional disparity. We all talk about healthcare disparities and racial disparities, but we don't talk about institutional disparities, where some of our own local hospitals are struggling. They are struggling right now to stay open and to provide care. And we need our communities at large to get more involved in local politics, not just on a federal level, on a national. Challenge your councilmen, your assemblymen to find out why our hospitals are not being properly funded. I don't know, it's just hurting. I'm sorry. I
appreciate you sharing that, especially, you know, educating us about the underfunded hospitals. That, you know, I appreciate it. Just listening to everything that you brought up, right? Because we're all looking at it from, those of us that are not doctors, which everyone on this panel is except me, and our audience, we're all looking at it as, you know, the information that we receive and the resources that we have. You know, RASHAWN mentioned toilet paper craze, but all of the things that you mentioned, from phones and tablets, everything that you mentioned was, I'm wondering, how do you feel better prepared now, if at all?
I don't know if we are better prepared because this pandemic became politicized. And if you look at how we gain money, as far as one of the ways that how the United States accumulate money is from war. And one of the things that I have said repeatedly throughout various interviews, whether it was on Dr. Oz to Rachel Maddow or CNN, is that this was a medical war. And unfortunately, we were caught in the middle. And what is daunting on what is really frustrating about this whole thing is that all it is about public health over profits. You understand? Public health. So many other countries around the world who have less than us as far as access to medicine and hospitals have done far better than what we did. What we did is that we are still in this toxic culture of individualism. Instead of saying, you know what, I'm going to wear my mask because I care about you, because I want to protect you. Now it's like, I'm not wearing my mask because it hinges on my freedom. And it just bothers me because I'm like, if you've seen the amount of people from 18 to elderly that have died at my emergency department, there's no way that you can sit here and say that I'm not going to wear my mask, I'm not going to practice public health measures. And part of that is the main culprit is President Trump. And he downplayed this whole entire pandemic. We saw what was going on in China and Italy. And by the time it hit the United States, we responded a little too late. And it cost the lives of millions of Americans, not just Black people. Native Americans also had the highest rate of COVID-19 deaths as we speak. It actually Native Americans actually outbeat Black people as we speak. And then after that is Latinos. And so for Black and brown people, yes, this is a war, not because of COVID-19. It's a war politically, it's a war socioeconomically, it's a war in the healthcare wise. It's a war spiritually, because there's so many factors that are going into this that we have to fight on so many different levels, to the point where that is causing depression. It's causing people to suffer from anxiety and insomnia. Many of us that were on the front lines have suffered from depression, anxiety, and insomnia. So do I think it's getting better? I would say that the numbers in New York, yes, have gotten better, even though the clusters had climbed up, but it's nowhere near what we did in March. And that's because New York had to come together. We all had to come together in New York, shut everything down, and had to work together as a community, no matter what your race, ethnicity, or socioeconomic status. We had to work together to bring our numbers down. And I wish that the rest of the country would have followed, because it's just really devastating to learn that between California and Florida, Arizona, all these different places have not yet necessarily decreased their numbers.
So, you know, and I'm glad that New York has improved so greatly, and that you do feel like people have come together. It is sad when you think about the fact that that's one state and that we are just struggling elsewhere. And so I want to ask you a couple of questions just to try to get to the nitty gritty for the day-to-day, right? You know, as you mentioned, we didn't know how it was transmitted. We were told to wash your Amazon packages, your groceries, everything. So, you know, in terms of what we know now, what would you say the best precautions are for the day-to-day citizen? That's my first question.
Well, first, continue to wear masks. Okay, because as you can see, again, what happened in New York and New Jersey, and I would say Boston, Massachusetts as well. I'm not going to forget the upper Northeast, but what we did was that we definitely took it seriously with public health over profits. And so even though it may not be economical or feasible to completely shut down the way we did, because now we're in this stage where it's like, okay, now we have to figure out the next step. Wearing masks is very important. This is an airborne disease, meaning that it is transmitted via respiratory droplets. That's through sneezing, coughing, talking. And so it is very important to wear a mask. You still got to continue to wash your hands and still practice physical distance. I know we say social distancing, but still practice physical distancing. To be honest with you, I don't think 6 feet is enough. 6 feet is not enough. I don't even think that's realistic. But however, if you are in a space where you are close in proximity, then it is best for you to continue to wear your mask. If you happen to be outside and you have no access to water, of course, carry hand sanitizer. You can make your own hand sanitizer at home, which is another thing that blew my mind about how a lot of the hand sanitizers were sold out, where you can learn to make your own sanitizer with rubbing alcohol, aloe vera, and if you want to put your little oils in it to make it smell good, you can certainly do that. Be self-sufficient. If you haven't learned anything from this pandemic, it's time for us to learn to be more self-sufficient in a sense where if I don't have this, what is the next step? And this pandemic had really showed us that our system is very antiquated. It has failed, and it needs to change. And so it still hasn't changed regarding of what we have done before. It's still very important until we find a cure, would it be a medication or a vaccine, a safe, non-toxic vaccine or medication to fight this disease. And I've seen every presentation under the sun, from children to adults, especially the elderly.
Understood. So you talked a lot about the effects, you know, the emotional and, you know, mental health effects of this on all of us, really. Of course, for those who are, you know, losing loved ones and on the front lines, we often don't think about the mental wellness of healthcare professionals. Like as civilians, we just don't. And so I'm really glad that you brought it up. I want to bring up Dr. Ally. And in the transition, actually, I'd like to show our clip.
I was so scared to even go to sleep. I was having panic attacks. He would just hear me crying and he would come up rushing up thinking something is wrong with me. And I'm just like, I'm scared to go to sleep because I'm going to die. Like this virus has me, you know, it's defeating me.
Being that sick with so little known about the virus, it just was the darkest place to be, right? So I had to get, like, I knew one day I was like, I have to get mental health help. I can't get out of this by myself. Like, I can't, like, I'm just so, like, it was just so difficult. And so, you know, I did seek out help, and it was extremely helpful, extremely. And I'm still, you know, I'm doing it, continuing, and I'm telling everyone I know to do it. You know what I mean? Like, everybody's going through something right now, right? It is really a hard time.
As Hillary mentioned, everyone's going through something. And so there are the direct effects of the virus and the loss and the death toll that many have watched up close and from afar. But there's also the lack of social, like physical interaction with loved ones. I'm curious for you, what do you experience the most when you're talking to people, whether it be social media or, you know, folks that you communicate with?
I think it's a lot of what everyone has been talking about here. So I want to establish, thank you so much for having me here. Like, these people on this panel are phenomenal. I have been out here like snapping and clapping and going off this whole time. Y'all couldn't see me. And I think Dr. Arabia made a really poignant point that we are dealing with trauma as a country, as a planet. And I think doubly and triply so as African Americans, during a time of election where there's a lot of contention, there's protesting in the streets in the middle of a pandemic. We're afraid for being, you know, about being shot by officers, while also having to be afraid of getting sick, while also having to be afraid of, are we even going to get good health care? If I am to enter a hospital, are they going to take my pain seriously? Are they going to treat me seriously? And so the number one thing that I'm seeing from people is trauma. And there's two types of trauma we talk about. There's trauma with a big T and trauma with a little t. Trauma with a big T are things that have happened directly to you that may result in your death or injury to you as a person. This can be personal illness, car accidents, trauma, rape, sexual assault. And then there's trauma with a little t. Even hearing about somebody else's trauma, having a family member, having a person on a show that you really care about, experience something, you can experience what we call secondary trauma or compassion fatigue. And this is what a lot of our first line workers are experiencing. If they're not experiencing their own trauma, they are experiencing the trauma of others. Like Dr. Arabia was saying, having to resuscitate or attempt to resuscitate a coworker, somebody that you've known and worked with for multiple years of your life. That is a trauma that we as in our generation, I can only speak for our generation, has not known. Most of us at least. And so we are a society traumatized.
And, you know, even to take it to the level of watching the news every day, right? What I don't want to do is underrepresent the fact that even if it's not happening as closely as it has happened for Dr. Arabia, it's okay not to be okay. We have to recognize that. And I think that we as in like the community as a whole has talked about the fact that there's a stigma on mental health in the Black community. And now more than ever, or now in addition to forever, we have to do what's best for us. We have to recognize this need. And so I'm also curious for you, have you seen an uptick? Are people truly asking for help when they need it or not right now?
Absolutely. I have seen many more people come into, I'm currently a coach, like doing life coaching, relationship coaching, and I have seen a huge increase. And also talking to some of my friends that are psychiatrists and psychologists with practices right now, huge increases in people coming in specifically with symptoms of depression, symptoms of anxiety. And these are things like Dr. Arabia hinted at a lot of them, changes in sleep, changes in appetite, feelings of guilt and shame. People feel guilty for feeling upset right now. There are some people that are like, you know, everyone's talking about coming inside and grinding all day, and I'm not grinding. I don't feel like, we're going through a pandemic. Like, and I think that there is a level of compassion that we have to try to have for self, that we are experiencing something that is so new for a lot of us, that we have to engage in a level of kindness and understanding that there will be days when you might not get out of bed, and that's okay. There might be days when you feel like it. It has to be okay.
Will you restate and then share any additional symptoms of depression, anxiety, etc., because I think that more of us than not can probably identify with them.
So specifically looking at depression, we're talking guilt, we're talking different difficulties with concentration and thinking, so this kind of fogginess. We are talking about psychomotor agitation. So these are people who might experience some increased activity. Maybe they're walking around their apartments, more pacing, or psychomotor slowing. So you can see people who don't want to move, who have a difficult time moving. For some people, depression even feels like being ill, which at a time like COVID, experiences of feeling sick, even if you're not sick, is much more common. People are like, oh, every time I think about COVID, my throat hurts. And so that's something that you can see with psychomotor slowing, and with a little small aspects of hypochondriasis, talking about sleeping changes. So this could be more sleep or less sleep. Some people are having insomnia, early sleep insomnia, middle sleep insomnia, or late sleep insomnia, where people wake up early, wake up in the middle of the night, or don't go to sleep on time. And then when we're moving,
No, I was saying, yep. And then I'm looking at, I want to encourage folks to ask questions in the chat, because we will start at, going to you all's questions. Go ahead.
And then when it comes to anxiety, we're looking at, this is tremulousness sometimes. So feeling of like a tremor or a shake, sometimes central body shaking, hands shaking. This is racing thoughts, worry thoughts, things that tend to grow and expand over time that kind of go out into their worst case scenarios. This is sweating for some people. This is dry mouth. This is a racing heart, and just a general sense of, I'm not going to make it. So a lot of people are having these sensations of like, I'm going to die, something horrible is going to happen. And it's because humanity, we love to try to predict the future. And one of the best ways we predict the future is by looking into the past. And so as we're hearing a lot of these things that are on the news, as we're hearing a lot of these deaths and things like that, we engage a heuristic called the availability heuristic, where the more we hear something, the more likely we feel like it's going to happen to us.
Yes.
Like, right? And so the more you hear about COVID, for example, when you hear about plane crashes, people become more afraid of flying, even though for plane crashes, it's something that's rare. As with COVID, there's so much misinformation. We don't know what's happening, but we hear it over and over and over again. So every time somebody stubs their foot and sees a mark on their toe, they're like, it's COVID toe. Every time somebody gets a cough and has to clear their throat, they're like, it's COVID. Somebody sneezes and they're like, hey, maybe this is a new symptom. And so we see people that are so anxious and so wired and keyed up, and it's difficult to calm down because there's not a lot of information with which we can predict what our future might be and predict what it is that is happening. And so we have a lot of people that are experiencing a lot of uncontrolled anxiety, trauma, and depression.
So can we also talk about, and thank you, Dr. Lincoln, for bringing it up, anxiety showing up as anger, particularly in women?
Absolutely. There is a lot of anger going around in general, as we see people refusing to wear masks, people engaging in, what was that, which just happened in Michigan, an attempt to kidnap one of the elected leaders of the state of Michigan, the governor. And we see a lot of anger in people as they feel out of control. Humans like to feel as if they can predict what is next, as if they have some sense of what we call agency over their future. And when we no longer experience this sense of agency, it can result in anger, because anger makes us feel more powerful than fear and then sadness. And for women in particular, there's a lot of pressure on women right now because kids are home. And if your kids are home, right? Like, kids are home. I mean, all my friends with kids, I don't even talk to them anymore. And I understand. I'm like, listen, we will just loop back around in 2022. I will still love you. But there's a lot of pressure on women right now in particular to be everything. They're still working because maybe they, like, I think it was Dr. Lincoln who mentioned, or Dr. Ray, people are still going to work. There's this idea that everyone's staying at home, and that's just not accurate. There are people who are still leaving the house and going to work every single day, but their kids are staying at home. You know, and what do you do with a 3-year-old that has to stay home, but you have to go to work, your partner has to go to work, and a lot of the weight is falling on women. And so for a lot of people, this is resulting in anger. Like, one of the things that we're seeing a huge increase in is domestic violence. And we are not going to know the true impact or sequela of what this looks like, because people calling out to like 911, a lot of the services that were in place before COVID are not intact in the same ways. And so we may not even have data on what domestic violence and anger and rage is truly looking like and manifesting like in people's homes.
And I also want to bring mental health full circle for a second and just remind folks, because we don't always deal with it, that your mental health affects your physical health. And so ignoring all of this and saying I'm okay, or it'll be okay, or everyone's doing it, so I'll figure it out, trying to be strong, brings about heart disease or cancer or all sorts of things that our body is holding on to because we're not dealing with the impact of the anxiety and the depression.
Stress manifests into physical ailments. One of the reasons African Americans disproportionately experience heart disease and cardiovascular disease, diabetes, is because of what we call the allostatic load theory, where as a result of long-term stress and epigenetics, which is inheriting genetic changes that happen over time as a result of environmental shifts and changes and environmental experiences, you pass down different DNA. We can get into the weeds on that, but you pass your DNA down, you pass trauma down literally through your bloodline. And so in our community, we literally experience these health problems because we are ensconced in a society that does not want us here, in a society that tells us in every way, shape, and form that we are not welcome. And from our schooling to school to prison pipelines to everything that we see, every time we watch an African-American man murdered on television, we experience trauma. Every last one of us that watch it, every time we hear about Black people dying of COVID, we experience trauma, and that is processed through our brain with a number of hormones, catecholamines, glucocorticoids, that release stress or other stress hormones into our body and tell our body that we need to run or we need to fight, but we're fighting something that we cannot physically fight.
And can I add that we think that social media is an escape, and a lot of the times the things that we're consuming there are adding to it. And so my little personal solution is to make sure that I'm incorporating positive or directly like mental health therapy pages into my social media. So that's what's coming up in my feed and not just the trauma. With that, I really want to see, hey, if y'all got some questions. Otherwise, Allie and I can do this all day. We can, everyone, all of our panelists are still here. So we definitely want to answer any questions that you guys have. Dr. Arabia probably could answer this. I see a question. We were talking about the airborneness of the virus. And of course, we're all wearing masks that cover our mouth and nose. What about the eyes as an entry gate?
Yes, so like I said before, or I mentioned earlier, I've seen various clinical presentations of COVID-19. And so one of the things that we saw early on was conjunctivitis. So there, conjunctivitis, or what everybody in the hood say, pink eye, like my mama would say, pink eye. And so, but the thing is about the pink eye or conjunctivitis, now COVID-19 has been added to one of the causes of conjunctivitis. So we have seen people that came into our emergency room with the pink eye, both eyes, both affected, and then they were tested for COVID-19. And so it has been found in small studies, not too many people, and forgive me, I don't remember the numbers exactly because it's nighttime. And you know, this is my downtime, that COVID-19 is passed through mucous membranes and the eye is open. Remember, the eye is the window to your soul. And so it has been passed into various patients through their eyes. So that's why when you see a number of us working during the pandemic on the front line, at the time you saw us with eye shields or eye goggles working because we were constantly being re-exposed. And the more you're re-exposed to this virus, the harder it will be for that person to fight it. And so, yes, COVID-19 can be passed through the eyes. Is it common? Not really, because we only see very few cases, but it doesn't, that's why we're asking everyone to wash their hands, keep their hands away from their face. The same thing that we tell you about the flu or the common cold, it's the same thing we're giving advice about in terms of washing your hands. And let me just make this clear, COVID-19, the coronavirus, is a subset of the family of coronaviruses. In the United States, we have already been exposed to at least 3 to 4 subtypes of the coronavirus. So this is why it's called the novel strand of the coronavirus, or COVID-19, because it was this new strand of the coronavirus was discovered in 2019. So I just want that to make that clear. And it's not the same as the flu. It is not the same as HIV/AIDS, because I've heard every single conspiracy theory and misinformation out there how COVID-19 is.
So I want to ask a question that I didn't get to earlier, which is, I want to talk about the vaccine.
Okay.
My understanding is the testing of the vaccine on everyone is necessary to see how it performs on different people, different ethnicities, et cetera. How do we know what to trust?
Well, first and foremost, we need transparency. We need all data, all safety and efficacy data. As far as physicians, we need to review all safety and efficacy data, even myself, before we can even recommend a medication or a vaccine. And studies have been, I mean, scientific research has been going on since forever. You got to remember, just to take it back to a little Black history lesson, the smallpox vaccine was created by an African slave in Boston. His name was Onesimus, and a lot of people don't know that because he didn't get credit for it. But he was the first African known to create a vaccine against smallpox, and smallpox is a virus. So sometimes people get it misconstrued that a vaccine, how can it fight against a virus? We have to go back in history and understand that our people had contributed to our medical society, had contributed to healthcare in so many various ways. And so one of the things is, and the reason why I mention that, because in order for us to go forward, we have to go back to learn our history, and that is called Sankofa. And the thing is about the vaccine is that we need transparency. We need to review all safety and efficacy data so that myself as a doctor can sit down and review and speak with my patients that come into the emergency room and explain the risks and the benefits. And also too, in the United States, the health literacy level is very low here. And so that the scientific articles that myself, Dr. Allison Hicks, Dr. Jennifer Lincoln, that we all trained to read as a part of our training, that's specifically written for us, but it doesn't translate well to the public. So the public might not understand what the numbers mean and certain terminology means. So that means that those same articles need to be written for the public so that the person that has very low health literacy level can understand these studies overall. And that's really important. It's about communication. I would never recommend anything to anyone that's not safe for me and it's not safe for my family. Now, if the vaccine is safe and non-toxic, I want to make sure that the background or there's a diverse background of patients, including Black people with similar health conditions or different health conditions of different age groups that received it. Because the thing is, the reason why Black people do not well, part of it being underrepresented in clinical trials is, for one, is a huge mistrust in the medical society, which we know historically for over 4 decades, with unethical experimentation conducted against Black people and other minority groups, but also the biases from non-Black physicians not offering those opportunities for Black patients to participate in these studies where they can actually benefit from clinical trials. As we speak right now, over 20% of those that are participating in the clinical trials for the COVID-19 are white people. And then, no, I'm sorry, that's wrong. 2/3 are white people, 20% are Latinos, and only 7% are Black. And that's concerning because that's showing us that, well, we're the ones that being underrepresented and we're the ones that dying disproportionately, but are we going to be the ones that are going to be able to receive this vaccination? And maybe not, because we don't know if it's going to work for us. And I totally understand the mistrust, but we have to come together and talk with community leaders as well, to sit down and really understand why clinical trials are important, your rights, and understand the terminology so you can feel safe, and also come up with a plan on how to communicate these scientific articles so that the layperson can understand and feel safe and secure.
I want to ask one more question that's in the box. How important is it for us to get our flu shot, and when should we get it?
So the flu shot is very important. And let me tell you the reason why. This is the flu season. In certain parts of the country, the flu season is not as prevalent like how it is here in the East Coast. But I was told by friends of mine in down south that the flu season is actually actually really bad as we speak. And the problem is that we're overlapping the flu season and COVID-19 to the point where that if enough people are not getting the flu vaccine, it is covering 2 types of flu. It's covering 2 strands of the flu, is type A and type B. And then there's another strand that not necessarily that is being covered by it. But however, it is better that you get covered, have coverage with the flu vaccine because of the overlap between both seasons. You don't want to get hit with the flu and you don't want to get hit with COVID-19 at the same time. Also, that it will be very hard, or it's going to become very difficult for a number of us to be able to differentiate if you have the flu or have COVID-19, because the similarities of the symptoms being produced from both viruses are very similar. And so we want people to make sure they are covered, so that way the mortality doesn't go up, especially in our poorer communities, especially those who are essential workers, especially our elderly population. We have to fight, and we have to make sure that we cover ourselves. We have to fight for ourselves and our lives. And that is by coming together and truly understanding what we're up against. And also, I suggest to a lot of people, especially my young people, Black people, know your history. Know that we contributed to medicine. Know that there were a number of us that also created vaccines to help our community or help the world as well. Don't go into this thinking that we had nothing or we didn't contribute at all, because the more you feel comfortable about who you are as a person, when you read your history, the more you're able to contribute to your community and do more for the community.
Thank you, Dr. Arabia. So I want to bring everyone back, mostly to say thank you, but in case there's something that you guys want to add, I'm trying to keep y'all to time right now. So if there's anything that you guys want to add, the goal here was how we can move forward from a place of confidence and not fear. There's a lot of fear and anxiety, and that's just what it is. But whatever, you know, we can start to feel a empowerment somewhere.
Empowerment.
Pray.
Pray, vote.
Vote, yes.
Okay, vote, and get involved in local politics. Start challenging these local politicians in your community to make sure funding is being being appropriately disseminated towards these hospitals that are based in areas that may not have much. Start finding out ways how we can turn these lots into food crops where we can harvest our own food. Start finding ways to be more involved, and not just through whether it be through social media, but become more involved. These talks are wonderful, but the actions and the follow-ups mean a lot. And so we have to do less talking and put more action into this, because the time is now. And, you know, we don't know what this election is going to be like. It could turn for the worse or it could turn for the good. But either way, we still have to put in the work. I think we got a little lax when Obama was in office. It's time for us to step up as a community and really put our words to action, including myself.
I was gonna say, I love that. And I also think fear is something we shouldn't necessarily turn away from. It is evolutionary and it is helpful. And there are some things that we need to be cautious of. And I think the fact that we are afraid of COVID is healthy. And if you are afraid of it, you don't be petrified, don't be frozen, but understand. And so I've created an acronym for fear, which is find and exercise the appropriate responses. So figure out how you should be responding to the challenge that is being presented to you. And what I found is the opposite of fear isn't always bravery, but it is purpose. When you have found something that you know you are supposed to do, it is easier to break through the fear. So you have to figure out, tap inward. We have time to turn, it's hard to be insular right now, but finding the things that make you happy, even if it's something small, even if it's in the morning, just sitting for 10 seconds and sniffing your coffee. Take those moments to find joy, because there still is joy even in the midst of an existential crisis, because that is what we are in the midst of. We are all being confronted with the finality of death and the fact that we are not in control of our lives the way that we thought we were. And it's okay to be scared by that, because that is scary. So it's okay.
And be okay turning things off. Like Cody said, you know, if you want to be able to control something, control what's on your phone, because you alone control what you scroll through. I know I deactivated Facebook like 2 months ago and I have not been happier. So control what you see. And don't give anybody airtime who doesn't deserve it. So if there's people out there who are saying things aren't real or it's not real, like you're choosing to follow them, you don't have to. Control what you can.
That means, Dr. Ray, you got to give us something.
I mean, they said it all. I mean, I think it was phenomenal. I think the bottom line is be the change that you want to see. And part of that means oftentimes what we hear from people, or particularly what I hear from people as a researcher and a policy analyst, is people talking about how deflated they are. They talk about their inability to control their outcomes. but everyone just highlighted ways that we can control things. It's not solely about who's running for president. It's also about down ballots. So latch on to what's happening in local elections, what's happening in state elections. The second thing is sometimes it's okay to have a non-response, but it's also okay to engage people, particularly people you care about. And I think we heard a lot about trauma and the way that COVID-19 is affecting people. We're dealing with multiple pandemics. You know, one of the things that I've always been saying about COVID is that there's a saying that most of you know in the Black community that when America catches a cold, the Black community gets the flu. Well, in 2020, when America catches COVID-19, Black people die. We know that's been the case. So what people need to do is call, text, get on Zoom or another platform with your loved ones and tell them how you feel about them, because you never know what's going to happen. The holidays are coming up and a lot of us are not going to be able to be around the people who we love and care about. But we can use technology to hopefully tell people about the sort of things that are going on and what we think about them, because we just don't know what's going to happen the next day. So be the change that we want to be. And part of thinking about that finally is, you know, we've lost several people this year, from Chadwick Boseman, like above me, I have the Black Panther figurine that my 8-year-old put in my office. But we also lost John Lewis. And when we think about John Lewis, one thing that him and Shirley Chisholm would always say is that if you're not sitting at the table, you're on the menu and someone's eating you for lunch. So Shirley Chisholm would say, bring a folding chair. John Lewis would say, it's not just important to be sitting at the table, but if you're being served up something that's not good for you, you then have to be the one to start creating the food that's at the table. The bottom line is that we all have a role to play. And when we omit ourselves from politics to say we don't want to vote, when we don't speak up for ourselves, when we go to seek healthcare and we know that we're being treated unfairly, or oftentimes we are observing other people being treated unfairly, and that particularly goes for oftentimes our allies and our advocates, particularly even for men standing up for women as well as for whites standing up for Black people. We have to advocate for the equality that we want to see in the world. And oftentimes that means speaking up and speaking out, because my grandfather, who served 21 years in the military, Purple Heart and Bronze Star, he always taught me that my silence is my acceptance. So don't allow 2020 to silence you. Use it to create agency and figure out a path forward.
I just want to thank all of you dearly for being a part of this conversation. So grateful. And y'all just dropped a lot of really great information and encouraging words, which was so necessary. So thank you so much. Dr. Arabia, get some rest. Same to you, Dr. Ray. For those on the West Coast, you know, whatever you do next. Thank you to those that joined us watching, and you know, have a great night.
Thank you.
Thank you.
Ashe.